Ohio. Ms. Brown, you are now recognized.
Thank you, Chairwoman Maloney and Ranking Member Comer, for holding this hearing today. Draconian abortion bans and restrictions that force people to remain pregnant further exacerbate racial health disparities. In places like Ohio, a 6-week abortion ban was slated to take effect following the Supreme Court's Dobbs decision due to the passage of Ohio Senate Bill 23 in 2019. Luckily, in Ohio, a judge temporarily blocked the state law and restored the right for Ohioans to an abortion. If this statewide ban were to go into effect, certain communities, especially those that have experienced generations of disinvestment, would suffer the most. So, Ms. Fry, when it comes to assessing reproductive health care, how do abortion bans and restrictions disproportionately impact communities of color that have been often left behind?
Thank you, Congresswoman. I think what we have to remember is that the status quo is not okay. The status quo is one where inequity has resulted in, as you point out, decades of disinvestment and lack of access to quality health care. And what we really want is the ability of every person, particularly Black women, Indigenous women, brown women, and people of color, to have access to quality health care, the health care that they need. And what happens with abortion bans is that it takes the decisions out of their hands. It forces them to look elsewhere and rely on systems that have perpetuated disparities for decades. This is bans that deny Black and brown women the ability to control their own bodies and instead have to go to state legislatures in order to figure out what health care they need is simply a step backwards. It will do little to address persistent inequity, and this is particularly a problem, as you know, with Black maternal health disparities. We have a crisis in this country. Black women are 3 times more likely to die than white women. We need to do more and not less, and more means making sure that they have access to the health care that they need, that they have access to doctors who can give them sound advice and not advice that is edited by politicians. That's what folks need, and that's what the abortion bans will do great harm to folks who really are trying to correct these persistent disparities across the country.
Thank you. So when we discuss the health impacts of abortion restrictions, we must also recognize and discuss the structural racism faced by people of color in our medical system. Across the United States, communities of color experience systematic health disparities, including higher rates of insurance, stigma, and the strain caused by racism. A national ban on abortion is likely to increase maternal deaths by 24% and increase maternal deaths of Black women by 39%. These numbers alone should scare all of us. Ms. Lee, I understand that following your own abortion, you began volunteering at an abortion clinic in Pennsylvania. Have you seen an increase in patients coming into Pennsylvania for abortion care?
Thank you, Representative. Yes, I actually now work full-time at the Independent Abortion Clinic in Pittsburgh, Allegheny Reproductive Health, and I am proud to work there alongside my colleagues. I answer the phones, and so I'm one of the first people patients are talking to when they're calling to inquire about abortions and to schedule their appointment. And about 2/3 of the patients in any given day I talk to are from Ohio, West Virginia, Kentucky. We've had a patient from Mississippi, from Texas, and even a patient who drove overnight from Indiana. And so we, as I said before, are only one of 2 clinics in all of Western PA, and so we are providing coverage for a lot of rural areas in Pennsylvania, as well as beyond. We're now the closest clinic for 70% of your state.
Thank you. It is also important to note for people with less income, the cost associated with abortion care, which includes the cost of the procedure itself, as you pointed out, transportation costs, child care, and taking days off from work. They all pose significant barriers to receiving care. State restrictions that force people to travel longer distances to see a provider make abortion care even more unaffordable. Dr. Kumar, you treat patients in Texas where the right to abortion was eliminated by Republicans more than a year ago. What has that impact been on the people of color who already experience disproportionate barriers? And I see that my time has expired. So
But Chief, if you could answer the question, her time has expired.
Sure.
Thank you, Chair.
I would say that abortion is an economic issue. Folks that I see often cite economic issues for needing access to that care, and when we're denying that care, we're forcing them to stay in poverty. That means the children that they're forced to have, as well as the children that are already at home.
Okay, thank you.